Do you like going to the doctor, or are you one of those people who puts it off as long as you possibly can? I'd like to talk to you about 6 excuses that we use to not go to the doctor and why that is putting you at some risk. My name is Margaret Manning. I'm with 60andme, and I'm really happy that you're here today. This is a super important topic. As we get older, we want to stay healthy and well, and our doctors are a resource for us to use. But you would be surprised how many people do not go to the doctor as soon as they have symptoms and just delay it for various reasons. I want to give you 6 kind of ideas of excuses that people use. Now, Anne-Marie Mersham is one of our bloggers who wrote this article. It's really well done in the sense that it captures the essence of why we don't go to the doctor. And of course, a lot of us have got Dr. Google to go to, and we've got lots of online resources that we think are going to be good enough, but it really, especially as we get older, is not so useful. You've got to go and see someone face to face. But anyway, did you know that a shocking percentage of adults over 65 just do not go to the doctor when they have symptoms that are recognizable, that you feel? And I think it's like 16%. This is a research that she quotes. 16% have never go to the doctor when they notice health symptoms. They just keep going until it gets worse. 17% continue a week. They wait a week, say, I'll give it another week or 2 weeks and see how I feel. It's really a ridiculous number of people who just are afraid to go to the doctor. And here are some of the reasons. Now, it's been especially challenging during the COVID pandemic because a lot of doctors have not been open, or at least they've been operating on very, emergency basis so that they could treat patients with the virus. Now it's starting to get a little bit easier in certain parts of the world, and I appreciate that as I'm recording this, it may be different in your situation, your home, but we can look at going forward. How to look at this in the future going forward. A lot of people, and by the way, I'm equally guilty and responsible for many of these excuses myself, and I'll talk a little bit about some of my situations that really, I did exactly what I've just said we shouldn't do. We shouldn't wait. If there are symptoms, we should call the doctor. Now, a lot of people are using telemedicine now, in the sense that you can call up your doctor's office or an agency that does telemedicine over the phone, listens to what your symptoms are, asks you questions, tries to probe and get to the bottom of what might be going on, and then can escalate or help you to get to the next step should you need help. Now, the first excuse that people use is, I'll just wait for my symptoms to go away. That's the easy one, isn't it? It's going to get better. And sometimes I've actually done this and, just waited weeks, like for something that's, it doesn't, what was the one? I had a little mark on my nose, and I thought, that's kind of interesting. It's a sunspot, whatever it is. And I didn't bother. I thought, it'll go away. And it actually did. I don't know, it was a freckle or something. It was like a sunspot, but it went away. But we do look at our symptoms and we think, that's going to go away. And especially, as I said, with COVID-19, you actually think, look online, and if it's not something really horrible, I'll just wait. I'll just wait till the symptoms go away. And along with that is the second excuse, which is, I can just self-diagnose here. What does the doctor know about this situation? I can just self-diagnose. Now, the internet I mentioned, Dr. Google is there to help us, WebMD, there's a whole bunch of them that are actually very informative. And it's true. You can get a lot of information that might eliminate a worry. If it's something that you might be lacking in your diet, or or something that you can try, if it's a symptom that's not, excruciatingly painful, but you can eliminate, but you have to really, in certain cases, go to a doctor or talk to a doctor on the phone. And, to actually say, ask the questions. Could it be this? Could it be that? Everything is cancer these days. If you don't know what it is, what are the signs of X cancer? And then when you look at the list on Dr. Google, it's like, 30 points, and 10 of them apply to you. They apply to everybody. So it's really self-diagnosing. We know this. I don't know. I'm not preaching. I'm just saying I've done this before. I'm sure you probably do it too. But what might happen, of course, is you need more tests, and you can't do that yourself. There's some things, of course, you can do to check your sugar level or whatever. But the doctor needs to look at you, ask the right questions. He knows what questions to ask, eliminate things, order more tests. It's really, really simple. So that's another excuse that we have, though, is, I'll just self-diagnose. The third, this is a touchy one. That is, I can't afford a doctor. I just can't afford it. Now, I understand this, especially in the United States, where medical bills are very, very high. And, the thing here, though, is that the earlier you catch a disease of any kind, or the sooner that you can identify what it is, the more chance you've got of surviving and getting through it and getting the right treatment. So if you cannot afford to do medicine, check out with your local social services. There's always some kind of a safety net. If not, I don't know all the details, so I'm actually talking off the top of my head, to be honest, because I've not been in the States now for over 10 years. So I know things may have developed, and you can, please let me know if I'm misrepresenting. But I think there are, according to Kathleen, or Anne-Marie, excuse me, there are always safety nets. Every country, every state has something, somewhere you can go and get some help, even if it's just on the phone. If that's not the case, I apologize, but it just seems to me that from what Anne has said in her article, that is true. The fourth thing is I don't have time. I just don't have time. And that's a difficult one in the last few months when we had lots of time. But some people will use that as an excuse. I just don't have time to go to the doctor. I'm just busy. And that's an excuse. That's what excuses are. They're not real. They're not practical. They're just excuses. So what's more important than your health? TV, reading a book, going for a walk, getting together with friends. Really, what is more important than your health? If you've got time to do any of those things I mentioned, then you have got time, honestly, for your health. And I'm not telling you what you have to do, but I just know from my own experience that it's been a wise decision to get advice from a doctor, face to face or on a phone. One thing for me was blood pressure. I can just share this because I take blood pressure medicines, and when I was during the COVID situation, there was a lot of press about, should you be taking blood pressure medicine, should you not? And I was just I was concerned. I was saying, what is the truth? And I called my doctor, and we had a phone conversation, and he laid it all out. And these evolving stories that worry you are sometimes things that hold you back. So another thing that is an excuse is true is to say, I don't want to bother someone to take you to the doctor. I don't want to ask my son to drive me or my friend. I don't want to be dependent on anybody. This is our classic independent streak as we get older. There's buses. There's rides to most hospitals. There's services. I know here in Switzerland there are special taxi services for older people. But if you need to get to the hospital, you can get there if you can't afford a taxi. I'm pretty sure that you'll find if you search around with charities, if you can't afford it, or just get a taxi, or just ask. It's okay. It's okay to be a little dependent now and again. Just to be able to say, to your friend or to your son or daughter-in-law, whatever, can you help me? Could you take me to the doctor's so I can just get this leg checked out or whatever? You'll find they'll be happy to help. But still, it's an excuse. I don't want to bother anybody. Another one, I guess this is the final one and big one, is I don't want to hear the results. I don't want to know. I don't want to know whether I have something that I just can't deal with right now. I understand that. I really do. We're all good at denial. It's just it's a way to protect ourselves, but it just depends how long you want to live your life in a healthy way. And as I mentioned earlier, getting the diagnosis, getting the test done, finding out what's going on, what's right or wrong, it can help you get earlier onto the healing path. The medicines are there for most things these days, or at least to minimize and help you. But you have to do it. You have to get over that denial. Did you know, I was just reading my notes here, according to the U.S. National Council on Aging, approximately 80% of older adults have at least one chronic disease. 80%. 77% have more than two. So I have one. It's a chronic illness, blood pressure, of course, and other things you might be taking medications for, arthritis or for whatever. Your 80% of people this is older adults, probably over 60, have chronic illnesses. So it's a real thing. We don't have to, and of course there's the four biggies, heart disease, cancer, stroke, diabetes. Those four cause 2/3 of all the deaths in each year. So, and those are things that you can do something about. You can get in front of them and you can go and see your doctor. So don't be afraid, go. Do you use any of these excuses? I certainly have. And I regret some of them, and I'm glad I went to see the doctor in most of the cases, and they don't mind. I mean, most doctors anyway. I hope that you've got a good one. So don't owe it to you owe it to yourself to give yourself good care. You want to live a healthy life, and just take that time to go visit your doctor. Don't be afraid. Go. So have you ever decided not to visit your doctor for any of these reasons? Maybe you've thought of an excuse that I haven't thought of. Nothing wrong with excuses, by the way. I'm not judging. It's just a way of an opportunity. It's an opportunity to change. So again, thanks so much for being here, everybody. By the way, I wanted to remind you, if you haven't subscribed to our channel here, would you do that for me, please? Just have to press the subscribe button. And then, of course, if you want to be notified when the videos are released, there's a little notification bell next to the subscribe button. Just press that, and then you will be told when the new videos are coming. We've got about almost 1,800 videos now on lots of topics. So, why not join the club, join the community here, and get into our YouTube world. Okay, everybody, have a fabulous day and take very good care of yourself. Bye-bye for now.